are the risk factors for otitis externa? For a person with a normal immune system, their risk factors are those outlined above in causes of otitis externa. Swimming and diving, or other water sports, can lead to otitis externa. Environments which are very warm or humid can lead to otitis externa. Trauma to the skin or epithelium of the canal may predispose to infection. Persons with diabetes and those who are immunosuppressed by disease or medication have additional risk factors for otitis externa. Diabetics with their elevated blood sugar and circulatory problems very easily develop otitis externa, either from the normal ear canal flora or from species not usually present in the ear. In addition, infections in diabetics often become invasive and can rapidly progress to life-threatening illness. Immunosuppressed patients are at heightened risk of otitis externa as their immune response to the initial onset of infection is much less than normal. Those with HIV disease, cancer, or other diseases causing immunosuppression who develop otitis externa for the usual reasons will often experience a rapid progression of the infection to local invasiveness or even blood-borne spread. The use of immunosuppressive drugs such as corticosteroids and other anti-rejection drugs by transplant patients places them at high risk for all types of infection. It must be kept in mind that immunosuppressed patients who become infected may lack the usual systemic signs of infection, such as fever, pain, or swelling at the site of the infection. They may also lack the feeling of unwellness and fatigue, which occur in a person with a normal immune system when they have an infection. How is it diagnosed? Diagnosis of otitis externa rarely requires more than a directed history and physical exam. Otitis externa must be distinguished from otitis media, as the two conditions are treated differently and can have different outcomes. Physical exam of the ear should include visualization of the eardrum or tympanic membrane as perforation of the drum with drainage, redness or bulging of the drum, or fluid or air bubbles behind the drum indicate otitis media. Perforation of the drum with drainage can lead to secondary otitis externa. Both conditions will require treatment. If the eardrum appears normal, the most useful part of the physical exam is a simple tug on the ear. If otitis media is present, an ear tug causes no pain. If otitis externa is present, an ear tug is quite painful. Diagnosis of otitis externa in a diabetic or immunosuppressed person is a much more significant situation and will often require advanced diagnostic technique such as an X-ray, computed tomographic or MRI scans, bone scans, and cultures of the infection. Any suspicion of infection in these patients must be brought to the attention of their physician urgently.